My name is Courtney Murphy, and I will be discussing Wilson's disease. What is Wilson's disease? It is a rare genetic condition that affects about 1 in 30,000 people. It causes a person's body to store too much of the mineral copper, and it prevents the body from getting rid of this extra copper, which can result in dangerously high levels that can cause organ damage. Although it is important to have a small amount of copper in order to stay healthy, too much of this substance can be poisonous to one's body. People who suffer from this disease usually have copper buildup in the liver, brain, eyes, kidneys, and other organs. This can then lead to organ damage and may result in death. Other names for this disease include copper storage disease and hepatocellular degeneration syndrome. Wilson's disease is a homozygous or heterozygous mutation in the ATP7B gene on chromosome 13q protein. This gene encodes a protein that plays an important role in the transport of copper from the liver to the rest of the body, and it helps remove excess copper from the body. It is an inherited disease, and it is autosomal recessive disorder, meaning that a person must inherit 2 altered copies of the gene, one from each parent. There are several symptoms for this disease. Since it is an inherited disease, Wilson's disease is present at birth, but signs usually start to develop as early as 5 years old and can even develop as late as 35 years old. People suffering from this disease develop chronic liver disease symptoms, which can include jaundice, fatigue, loss of appetite, easy bruising, abnormal fluid retention, weight loss, nausea, and vomiting. People may also suffer from neurological or central nervous system symptoms, which can develop in children or young adults, which include clumsiness, trembling, difficulty walking, speech problems, and schoolwork problems. About 1/3 of the people will experience psychiatric/mental health symptoms, which include depression, anxiety, and mood swings. Eye changes and vision problems are prevalent in most people who suffer from this disease. This includes Kaiser-Fleischer rings and difficulty in eye movement, especially looking upwards. Diagnosis for Wilson's disease includes physical exams as well as lab tests. The physical exams are to detect signs of liver disease and neurological function. Doctors will use a slit lamp to detect Kaiser-Fleischer rings, as shown in the picture to the left, which is found in almost all people with the disease who show signs of neurological damage and about half the people who have liver damage. Kaiser-Fleischer rings are deep copper-colored with rusty brown rings at the periphery of the cornea, which represent copper deposits. Physical exams are not sufficient enough in diagnosing the disease, and lab tests are also required to measure the amount of copper in the blood and the urine. Lower than normal levels of copper in the blood are prevalent in people who suffer from the disease, and lower blood levels of a protein called ceruloplasmin, a protein that contains copper. People may also suffer from acute liver failure, which is prevalent in people who have copper levels that are higher than normal in their blood. If this does occur, urine is collected over a 24-hour period to look for increased copper levels. A liver biopsy may also be necessary, and it would then be examined under a microscope to detect any copper content, and that would then be measured to see if it is higher than normal. Genetic testing can also be a factor in diagnosing this disease. Medical history is also looked at, since it is an autosomal recessive disorder. If the parents can have symptoms of this disease, it is likely that the child will develop this disease too. Treatment. There is currently no cure for this disease, but therapies and treatments do exist to reduce and control the amount of copper that accumulates in the body. It must be treated throughout their lives by taking medication and restricting their diet. If treated early and effectively, people can usually have good health. There are 3 steps in the treatment process. The first step is removing the excess copper from the body. This can be done with FDA-approved treatments such as trientine hydrochloride or sapropine and D-penicillamine or cupramine. These help remove copper from the organs and release it into the bloodstream for it to be filtered out by the kidneys through urine. Side effects of these include worsened neurological symptoms, fever, rash, and effects on kidneys and bone marrow. Zinc acetate or glycine is another treatment that people can take, which helps keep the digestive tract from absorbing copper. A second step in the treatment is reducing the intake of foods that are rich in copper. During treatment, people should avoid chocolate, mushrooms, and nuts. And overall, people should avoid the intake of liver or shellfish, since these foods contain extremely high levels of copper. The third step in the treatment process is treating any liver or central nervous system damage that may have already occurred. If treatment is not effective, or if liver failure does develop, a liver transplant may be necessary. People who do suffer from this disease can undergo these treatment plans. However, it can have an effect on one's lives, and they must overcome certain obstacles associated with the disease throughout their life, including diet, neurological symptoms, and mental health issues.